Harilalji, you're a yoga therapist and you teach yoga therapy. And in another interview, you said you have a 100% cure for migraine patients. And so I would be interested, and many of our viewers would be interested, how does yoga therapy deal with migraine headaches?
Migraine is a lifestyle disease. Stress is the main cause for migraine. So correcting our lifestyle, change our attitude towards the life, and combine with some proper diet and proper exercise can give a lot of changes in migraine immediately.
Some say there's some hereditary case with migraine. What is your opinion about it?
Migraine is a behavioral hereditary. It's not coming through the gene, but it is getting from the interaction with the member from our own family or from the society. So by learning a certain way of behavior, the other person get this habit. So it's not through the gene, but it's a behavioral hereditary.
That would mean one could easily, or at least one could change it also. That sounds very positive news.
That means we can influence very easily through vidya-yoga-therapy, through the yogic counseling.
You recommend any specific diet for migraine patients?
Yes, migraine patients should reduce the rich food. They should take a moderate diet, vegetarian diet, with lot of natural fibers. It is recommended to avoid the rich milk products and white sugar, and better to completely avoid the alcohol. Some people recommend only red wine, beer, but I recommend completely avoid the alcohol and smoking and coffee also. But those who stop alcohol and coffee and smoking, I recommend stop slowly, especially the coffee. Stop slowly, otherwise it can give some withdrawal syndrome and that can bring the attack again.
Regarding exercises, what would you recommend as exercises for migraine patients?
Shosana Chalana Vyayama is more useful for migraine. Shosana Chalana Vyayamas are the combination of body movement with breath and mind. It helps us to synchronize our body and mind. It is very useful for slow down the mind. Also, we have a head rolling exercise which give a good massage to the head, which can also use during the migraine.
Any specific pranayama breathing exercises for migraine patients?
Nadi Shuddhi, Ujjayi, and Chandra Anuloma, the left nostril breathing, is very useful. Chandra Anuloma is more influencing the mind in slow down. Chandra is the god of mind. So through breathing through the left nostril, we can slow down our mind. Before Nadi Shuddhi, 2-3 minutes Chandra Anuloma is advisable. In Nadi Shuddhi, we should practice without holding the breath. We have a simple Nadi Shuddhi in which we are not counting, but we are focusing on the slow breath and we are focusing on the rhythm of the breath. In Kapalabhati, we should do mild way. We don't do advanced pranayama like Bastrika and long holding, Kumbhaka should avoid.
Regarding stress management or yogic counseling, what would you advise specific for migraine patients?
Yogic counseling is the interaction between the counselor and the participant. There the therapist is helping the patient in how to handle the difficult situation in the life. So we are giving the Vedantic wisdom to this person through interaction. It's not a one sitting counseling. It's not we are sitting half an hour or 1 hour for counseling. But we are doing that any moment we meet with the patient. Sometimes we talk 5 minutes, sometimes we talk 10 minutes. We are not specially sitting for that. Any moment we are getting to talk about wisdom, we are utilizing. So it's a kind of interaction. The wisdom we cannot impose on someone. Wisdom flow like a water from up to down towards the deserved person. So if the therapist has the wisdom and if the participant has the trust towards the therapist, when they interact, it automatically flows. That is how we are strengthening the Vijnanamaya Kosha. With that, we are also giving some technique to control the emotion like chanting, meditation, some Shosana Chalana Vyayama, so that it helps to work the wisdom fast.
And you said that if one observes these techniques or uses these techniques, then migraine can actually be cured on a long-term level.
Yes, we get immediate result. That means we can arrest the migraine, and by regular practice, normally in 6 months, it almost completely abolished. Still, we have to continue the practice because the root will be in our system. So maybe 1 or 2 years, if we practice, we can make sure it will never come again. And we also using some Kriya technique to arrest the migraine. For example, when a person gets the sign of migraine, if we do the Kunjal Kriya, Vamana Daudi, we can stop the migraine. That's the advantage of yoga therapy. Without using any suppressing medicine, we can control many diseases. The advantage is that there is no side effect. Same time, these practices are training our nervous system. It's soothing and calming our nervous system.